I am Dr. Rupali Jain, consultant neonatologist and pediatrician at MGM Hospital, Vashi. Also, I am assistant professor in Department of Pediatrics at MGM Medical College, Kamakya. Today I am going to discuss a very important topic of complementary feeding. In easy terms, it is introduction of solids to your newborn. So your baby is actually biologically ready by 4 to 6 months of age to accept solids. WHO, or the World Health Organization, recommends to introduce solids after 6 months of exclusive breastfeeding. So now we are going to talk about the various aspects of introducing solids, like what thing to introduce, how frequently to feed the child, what quantity to feed, what substances to give, etc. So first and the foremost thing, whenever you start complementary feeding, you have to remember that the breastfeeding has to be continued. Please do not drop the number of breastfeeds in the day. You usually start with, we recommend either a mono-cereal based diet, that is a single cereal. So rice is the most commonly available, easily acceptable, very easily digestible by your kid. So rice is mostly recommended. Other than that, you can also start with either a fruit or a vegetable as it suits your family. After the mono-cereal diet, we then shift to a multi-cereal diet, that is many cereals. Then you can add pulses to it, slowly add vegetables to it, and thus the child can slowly shift to a wholesome or a balanced diet. So there are few points that you need to remember while practicing complementary feeding. First and foremost, every new item has to be introduced in the morning hours. Say your child is allergic to it, you will never know, or it will be difficult to seek medical help late in the night as compared to the day. So it is recommended to introduce everything in the morning hours. Secondly, always introduce each ingredient separately, and then you can shift to mixing of various ingredients. So next would be the frequency. So usually when you start complementary feeding at 6 months of age, it is recommended to start with at least only 1 serving per day, and slowly as you move from 6 months to 9 months to a year, you move from 2, 3 to 4, 5 and 6 servings per day as the child increases with the acceptability. Child initially may accept only half or 1 spoon per day, and then slowly the child start accepting half a katori to 1 full katori. So the quantity of food is usually guided by the child on his own. So other few important tips that you can keep in your mind while practicing complementary feeding is, whenever you sprout or germinate any pulses, then it always increases the digestibility as well as the nutrient value of the food. So it can be more helpful in giving the child a balanced diet. Now this is a very common confusion among the parents, whether to give homemade food or the readily available pre-packed food for the child. So usually homemade food are easily available, can be readily made, more hygienic, clean and easily accessible, and can be provided to the child. Now the packaged food is also available, it is hygienic as well, it can be easily prepared, and the thing is it is fortified with certain vitamins and minerals as well. So usually it is said, if you have a balance between your homemade food as well as packaged food, the child would receive a complete balanced diet. Hope this talk was helpful, and you can take away few tips which will help you better complementary feed your child. Thank you.